Hello, my name is Muhammad Afiq bin Zulkifli. Today I'm gonna present about axial and oblique for the toes. So this is a toes anatomy. The axial toes. This is a radiograph of the axial projection of the toes because we can see the concavity equal on the both side of the phalanx, and this image include from the distal phalanx until the metatarsal. So this concavity is equal and it include from the distal until the metatarsal. The positioning for this projection is incorrect because soft tissue wide and the midshaft concavity are unequal on the both side of the phalangeal. And the fourth and the fifth DIP and PIP joint are closed. We can see this fifth and fourth if DIP and PIP joint is closed. So this is a incorrect positioning for the epiaxial toes. The mixture concavity on the medial surface. We can see this image taken with the toe rotated laterally, so patient need to rotate it medially until the toe of the interest is flat against the IR. This side is more concave than this side. It is a external rotation. So this is a internal rotation. For internal rotation, the mixture concavity on the lateral surface. We can see this image taken with the toe rotated medially. So patient need to rotated laterally until the toe of interest is flat against the IR. So the IP joint space are closed and distal phalanx is foreshortening. The toe was flexed and the CR was not aligned, parallel with the joint space of or perpendicular to the distal phalanx. If the patient condition allow, extend the toe, placing it erect flat against the IR. So we can see this IP joint is closed and the distal phalanx is foreshortening. So this is a flexion. So epi-oblique toes. This is a radiograph of the oblique projection of the toes because mixture concavity of the proximal phalanx is not equal. The image include from the distal phalanx until the metatarsal. The positioning for this projection is correct because we demonstrate more phalangeal mixture concavity, twice as much soft tissue wide on the side, positioning farther from the IR. So we can see this side is more concave than this side, and the wide of this side is more than the this side. Epi-oblique toes. This image shows that the obliquity is more than 45 degree. Posterior aspect of the proximal phalanx midshaft demonstrate more concavity than the anterior aspect. The posterior aspect is more concavity than the anterior aspect. This image show that the obliquity is less than 45 degree because we can see the midshaft concavity on the both side of the phalangeal are most equal. You can see this side and this side is small like equal concave. The alignment X-ray tube versus film. The alignment between X-ray tube and film is cannot be determined because there is no forwarder of collimation. The X-ray tube versus patient. The alignment between X-ray tube and patient is cannot be determined because there is no forwarder of collimation. Patient versus film. The alignment between patient and film is incorrect because the right side is longer than the left side. The right side is longer than the left side, and upper side is longer than the lower side. So the centering point for this radiograph cannot be determined because it has no forwarder of collimation. The standard centering point for this projection should be at the third MTP joint. So this collimation, the superior border that should be included is distal phalanx, IP joint, the medial phalanx. So the inferior border that should be included are the MTP joint, the metatarsal, the fifth proximal phalanx. So the lateral border that should be included are the fifth metatarsal, distal phalangeal, and the first metatarsal. The exposure factor for the KVP, it has used KVP adequate because we can see the contrast for the thin structure. Bony cortical outline of distal phalangeal can be seen, and for the thick structure, bony cortical outline of the metatarsal can be seen. The MIS used is adequate for density because the thin structure, which is the bony trabecular pattern of distal phalangeal, is adequate. Can be seen for, and the thick structure, which is a bony trabecular pattern of the metatarsal, can be seen. So the markers, there is evidence of anatomical markers shown in the radiograph correctly placed on the left side of the body, show appropriately and not superimposed with any region of interest. Static value, the film size should be used is 18 times 24 cm, which is sufficient to demonstrate all structure of interest. There is no evidence of artifact on the radiograph. Name, the patient name and ID, date of examination, place of examination are not visualized. The proper place for the patient name at the top side of the film. The radiograph is unacceptable because there are no patient names, ID, date of examination, so it will be a misunderstanding. The positioning is incorrect because the fourth and the fifth digit are flexion. So this is my reference, and thank you so much.